If you were to pick it up and read it, it will give you a really good idea of what you're actually walking into in terms of the care that you're supposed to provide for the particular patient you're going to be working with. So the passport is a patient health document, like I said. The patient goes in with it and they actually come out with it, and that's why it's actually called a passport. It's kept by the patient's bedside, or it's kept at the top of the bed when you actually walk onto the ward, and it's for use for nurses, doctors, occupational therapists, porters, anybody who's actually working with a particular individual. And what we'd expect to find is within the passport, it's completed by people who know the person really, really well. So the person who's going to complete it is not the person who's actually working within the hospital, but it's going to be the carer who knows the person really well, or it will be the person with the learning disability themselves. If you were to pick up the passport and refer to the back of it, you'd have all these categories in terms of what the patient's needs actually are. Okay? And if you look at mobility as an example, you would expect to find information around, can that person actually walk? Are they unsteady on their feet? Do they need to be using a frame or walking stick? Do they need to use a wheelchair? Can they walk for a long distance or only for a short distance? These are some of the cues that we're expecting people to be able to know and point out. Personal care. Can the person wash and dress themselves? Do they need support? What's their level of skill in terms of that? Can they go to the toilet by themselves? This is what's really important on an actual ward when you're actually working with somebody within a hospital. Sleeping and bedtime. What time do they go to bed? What time do they normally wake up? Do they sleep all the way throughout the night? Again, if it's written in there that somebody sleeps all the way throughout the night, and we find in hospital they're waking up 4 or 5 times during the night, we need to start thinking, what is actually going on for that particular individual? How do they communicate? Yeah? Do they use Makaton? Do they use a complex form of communication, maybe sign language? Or do they vocalize in a certain way to try and express things? And again, within communication, the key one within hospitals, how do they let you know they're in pain? If they're going to be in pain, how would you know? If you're a member of staff, how would you know the person is actually in pain? Mental health and behaviors. Do they have a mental health diagnosis? Are they known to a particular mental health learning disability team? What sort of behaviors do they have? Do they have any challenging behaviors that staff need to be aware of for staff safety or for the safety of the patient themselves? Occupying themselves. What's important for that person? So what do they like to do? Do they enjoy music? Do they enjoy sport? Do they like to watch television? Again, this is a very good starter for conversations for acute hospital staff. Because if you're a nurse or a doctor working with an individual, often, if you talk to them first about what they like to do, it calms the patient down, because you're forming a rapport with a particular individual. It gives you a better chance of actually working with them. Safety needs. Can they press the call button to alert the nurses that they need some help? That's very, very important. There's nothing worse than being in a situation where you're in pain or you're distressed, but you don't know how to actually call for help. Right? Do they need to have the bedsides up at all times? Maybe we need to think about, do they wander on the wards? Is there a risk they might walk off the ward? Again, that will be within there. Taking their medication. How do they take their medication? Do they like to take liquid medication, or are they okay with tablets? Do they maybe have their medication with food at all times? Again, it's really, really important for people to be aware of how people take their medication. And eating and drinking is another one we've got in there. So what do they like to eat? What do they like to drink? Very important, because in hospital, I know there's a big joke about how hospital food is not always the greatest, but if you're constantly giving somebody something they don't like to eat, it's no surprise somebody's nutrition is going to suffer, and that can have a detrimental effect on their actual health needs themselves. So the hospital passport, if it's filled in appropriately, it is a valuable tool in terms of communication between the person with a learning disability and the hospital staff. And if they picked it up and read it, it will give them a really good idea of who that particular person actually is. And it's not only to be used within hospital. There's no reason why this can't be taken to the GP practice. Yeah? If you're going to be seeing a practice nurse, this information will be valuable to them as well. If you're going to the chiropodist, again, it's going to be very, very important for them to be aware of some of these things. The dentist, anywhere where you're going to be accessing and meeting health professionals, the hospital passport will really help you to be able to tell people what it is your needs are, and also for hospitals and staff to be aware of how best they can go about supporting you.